Welcome to Europe Explained, brought to you by the Council of Europe. This podcast series offers a unique window into what we're doing to create a fairer, more democratic Europe. Through conversations with experts and frontline workers, we bring you closer to the issues that matter, from fighting discrimination to upholding human rights, from defending democracy to building laws, systems and institutions that are just, fair and open to all.
Welcome to this new episode of Europe Explained, the Council of Europe's podcast that highlights the work of the Council on human rights, democracy and the rule of law. In this new episode, we're going to talk about persons deprived of their liberty in social care institutions. So we also have another episode focusing on psychiatric establishments. So keep an eye on it if this topic is interesting for you. Two experts are going to share their work with us in this episode. Christian Loder, hello.
Hello.
You're a member of the CPT Secretary and you've worked for the committee basically for more than 15 years. Maria Metsova, hello.
Hello.
You're the first vice president of the CPT, lawyer by training, and you both conduct visits into social care institutions across Europe. So first question for you. When we talk about social care institutions, what exactly do we mean, Christian? What kinds of institutions do you visit with the CPT?
Yes, thank you. These are establishments that are very much diverse in nature. They may accommodate residents of different ages and of different profiles of disabilities. They might have intellectual disabilities, mental disabilities, chronic mental health conditions, or physical impairments. And they also intersect. They intersect also when it comes to different categories of ages and vulnerability. They are very diverse also in terms of size, in terms of design, and they are different also in terms of their legal nature and the legal status of persons who are accommodating therein. Person might be accommodated in those establishments by virtue of a private law contract, or they might be placed forcefully in there, or if they are subject, for example, to different guardianship regime or other substitute decision-making processes. So they might be also forcefully find themselves accommodated. In the past, the CPT has started monitoring this type of establishments since 1997. It was the first time we visited a social care home in Estonia. And we have visited so far more than around 150 such establishments, which in numbers is probably less anyway than other institutions, that prisons, customary institutions that we normally visit, such as prison, police station and psychiatric hospitals. But we have accumulated anyway a certain degree of knowledge and experience, and based on this anyway we have more and more developed and improved, if we may say so, our standards in that field.
And I expect the situation is very different from one institution to another. But Marie, what does deprivation of liberty look like in these places, in these settings? How does the ill treatment look like there?
We ask these questions ourselves, since the CPT mission is to examine the treatment of persons deprived of their liberty. And therefore we look at this aspect before we start a visit. In reality, not all homes are places of deprivation of liberty, and not all residents find themselves in the situation of deprivation of liberty. But the fact is that many are. You may point out that placement to homes often happen upon a contract, but contracts are often made by legal guardians and not by the residents themselves. So de jure, the situation may be voluntary, but de facto not. So firstly, it is important how the residents themselves perceive the situation, whether they are satisfied with their placement and stay, whether they want to leave the facility. We can also observe this in people who do not communicate verbally, for example, when they try to leave the facility. And secondly, voluntary or not voluntary stay is a question of whether measures are in place that actually prevent residents from leaving. This is obvious when the facility is locked, when they are physically prevented from leaving, or when they are returned by the police, for example. However, it is also important to consider the extent to which residents' contact with the outside world is restricted, we see often that de jure voluntary residents have absolutely no contact with outside world. They are restricted in using telephone. So we see residents deprived of their liberty de jure based on a formal decision, but also de facto based on the real situation. And both are in vulnerable situation. This is why this monitoring is important.
And to prevent these situations, what would the CPT standards be, Christian? What standards do you rely on during your visits?
We are an empirical body, so we developed our standards based on our observations in a very sensorial manner, basically, according to what we observe and in accordance with the experience they accumulate. And also in the light, anyway, of living international legal instruments, we develop standards, which are soft law standards. And in this particular field, we have accumulated a certain knowledge and experience, and we have come up anyway with a certain corpus of standards that we will publish in the course of this year. So far, we have only published a fact sheet or a checklist in 2015 and I think in 2017, so it's been already some time. And we will now present anyway a certain corpus of standards which will reflect basically all the areas of our mandate. And these span from the prevention of ill treatment within social care homes, proposing anyway measures on how to detect and to investigate and possibly eradicate physical and psychological ill treatment. They also refer to living conditions in social care homes. So what we would like to expect, what the committee, what the CPT expects to find in a social care home in order that this provides dignified living conditions. This refer to very concrete aspects such as the size of rooms, the equipment, the access to light, the quality of food, as well as the care that is provided to residents in coping with their daily needs in terms of personal hygiene and so on and so forth, and sometimes also in terms of procurement of different items. They also relate to the legal safeguards concerning their placement and the review of their placements in those social care homes, and also the complaints. So to which extent they can file and lodge complaints. And it's a very challenging situation for persons who have certain vulnerabilities and they cannot express and verbalize themselves in a coherent manner. And so how they can, for example, lodge complaint, or they can complain about their own situation to especially external independent bodies in order to redress their situation. And of course, we developed standards on the monitoring that we would like to expect of this type of establishments, because of course, we are talking about a very large dimension of population that lives in long-term institutions. I think there are estimates that within the European Union, more than 1.5 million persons live in long-term care institutions, and even more in the rest of the Council of Europe region. So we would like anyway these establishments to be monitored by independent bodies on a regular basis in order also to comply with our standards and to advance also the compliance with our standards.
And in some of your recommendations and some of your reports, do you also sometimes suggest moving people away from larger institutions, Marie, and supporting them in community-based settings, even if that may be a bit more difficult to follow at the CPT? But is that also something you recommend, deinstitutionalization?
Let's use the short DI.
It's a very difficult word. Deinstitutionalization.
Well,
I haven't said where.
I would start with a statement which is well known and also observed by the CPT, that the mere fact of being treated in institution brings a risk of ill treatment. Of course, the nature of institution makes difference what the risk, but there is an inherent risk. And also in the light of other rights of persons with disabilities, European countries work on the institutionalization of social care services. While the CPT is not an expert body regarding it, we cannot be silent. For example, when we see that plans on DI stay only on paper, it is already a couple of years when in every CPT report there is a paragraph or even a small chapter on DI projects and their success in the country. When the institutionalization projects undertaken consist of the transfer of residents to smaller housing units, but still in existing larger social care homes in remote areas far from urban centers, this cannot be called deinstitutionalization. But alas, we see it in many countries, and then we try to point it out. In such cases, the residents continue to reside on the same site and are cared for by the same staff and in nearly identical regimes. So this is not a real change, and this is not really minimizing of risk of ill treatment. So from this point of view, CPT develop some jurisprudence on that, yes.
And Kristen, what can we say about hidden ill treatment if we're back into more formal institutions? Is that also a concern for the CPT?
Yes, with a caveat. Physical and also psychological ill treatment is hidden per definition in all types of institutions anyway, whether it be police stations or prisons anyway. Is always challenging anyway for our committee to discover, prove ill treatment, and of course advocate for its eradications. And we adopt always different tools and methodology. But I would say that in social care institutions this is even more challenging because of the nature of the profile of the residents themselves, who sometimes cannot verbalize their feelings or they cannot appropriately complain or describe their situation. But it's also accentuated by the fact that ill treatment in social care homes, in accordance with our experience, whether it's violence or not, is also characterized by neglect and other inherent risk factors, such as, for example, understaffing or lack of training of staff, which are not so self-evident, prima facie self-evident, at least not to those who are not professionals with decades of experience, such as the members of the committee are, in uncovering these patterns. So I would say, yes, it is more hidden than in other establishments that are visited by the CPT, and is much more difficult to prove it because of the reasons that I said earlier, and in addition because of the fact that accountability mechanisms need to be more sophisticated. And also investigative techniques needs to be more intrusive and more complex than in other settings.
And you were mentioning the lack of staff. That I imagine that depends on the budget too. So how difficult is it? I mean, that's a challenge in many areas for the Council of Europe, but maybe even more complicated when it comes to social care institutions. How difficult is it to apply the same standards across all European countries, Marie? And is it possible?
I would begin with the point that this is really a challenge, and across Europe, the CPT sees different traditions and culture in provision of care, and its systems, different regulatory frameworks, and also funds available. So we see situations which are quite good or even very good, excellent conditions, and also the way the care is provided. But in some countries, the CPT sees exhausted staff, so low in terms of numbers, but also abandoned by the authorities and politicians the same way as the residents themselves. You may know that the CPT already made one public statement on situation in social care homes. It was in 2021 regarding Bulgaria. The CPT was led to this conclusion by very serious findings in the facilities, but also by the government's unwillingness to take corrective action, and really sometimes struggle with governments to make them for any change. So the different situation in European countries is the reason why the CPT's recommendations towards countries sometimes differ considerably. But what applies in all European countries is the general risk of ill treatment inherent in institutions that are closed or that care for highly vulnerable people. So therefore, some minimum standards should be general.
And Kristen, I was saying at the beginning that you've been working for the CPT for a long time. So how is monitoring these places different from visiting other institutions? I mean, is it partly because you were mentioning the fact that some residents have difficulties expressing themselves or making complaints? So, I mean, what is your solution there? Are you counting on the staff to talk to you and cooperate? What's your solutions there?
Yes, first of all is the diverse nature of these institutions that can be very variegated, and the profile of residents is very different. This already poses certain challenges. As you were mentioning, the fact that unlike in other settings, Many times, frequently in social care homes, residents cannot effectively verbalize or articulate their thoughts. Requires certain specific interviewing skills from members in order to elicit certain information, which is crucial for our monitoring work and for the report drafting. We have to resort to alternative methods of fact-finding, such as careful examination of other type of recordings. This can be incident registers, other monitoring tools, personal files, medical documentation, CCTV recording, and so on and so forth, as well as reports from oversight and inspection bodies. So I would say, yes, it is certainly more challenging to monitor these type of institutions than other classical establishments visited by the CPT, and this is also the reason why I think we ventured into this effort of developing standards specifically targeted for social care homes, because so far, and I think I'm not exaggerating by saying so, we were mutuating also methodology, tools, as well as standards from other fields of our work, such as psychiatry, for example, when it comes to treatment and staffing, or the medical aspects of care in social care homes, or carceral environments when it comes to living conditions. So for the first time, we are now developing standards that are really targeted at these type of institutions, in order also to support other monitoring bodies at the national level to engage in the same type of work and venture.
So you've both mentioned a lot of challenges for the CPT and for your visits. The last question I often ask members of the CPT is, do you feel that your visits actually make a difference? Have you got positive examples to just feel that your work is changing lives in some institutions?
Absolutely.
I hope so.
The visits make a difference.
Yes.
Firstly, the situation of de facto deprivation of liberty of residents is now much more recognized, and safeguards are step by step introduced to protect them in countries. And the risk of ill treatment is more known, and there are measures taken to address general risks, at least in some countries, which now can serve as positive examples. Secondly, I would mention that we also see judgments of the Strasbourg court fed by the CPT's expertise, where the court gives legally binding interpretation of what is ill treatment, prohibited absolutely, in terms of living conditions or use of measures restricting free movement of persons. And governments take seriously Strasbourg court's judgment. So again, this has really impact on standards, national standards of material technical conditions or of staffing levels. And finally, on the most concrete way, we finally see significant decrease of use of mechanical restraint or so-called net or cage beds, for example, than CPT saw 15, 20 years back. So we must think broadly and in long term, but the impact is obvious.
Yes, and we have to say that we are seeing, and we are encouraged by the fact that we are seeing more and more countries engaging seriously into legislative reform of the disability sector. That also includes long-term institutions. But on the other hand, we also see, and we continue to see in our visits, too many institutions of a large size, the so-called total institutions, where hundreds of persons live and sleep in settings completely cut off from the rest of the society. And this remains a reality. And as long as it remains a reality, I think there is work for the CPT to do and to advance its standard.
Well, good luck for the next visits. And thank you for coming and sharing your work. Thank you.
Thank you.
If you enjoyed this discussion and wish to explore more topics, be sure to check out the episodes of Europe Explained. You can learn more about the Council of Europe and its initiatives at our website, coe.int. And don't forget to follow us on social media for the latest updates and insights. You can find us on X, LinkedIn, Facebook, and Instagram.